We're going to talk your health this morning, health for both men and women, because the month of May happens to be Stroke Month. Dr. Alison Bailey is here. She's a cardiologist, which is why I said Heart Month, but she is with Centennial Heart at Parkridge. Good to see you.
Thank you for having me.
So I have long had conversations with the Heart Association and then the American Stroke Association because the two are so closely connected. I love the fact that your practice at Parkridge, the health system, intentionally teams up with focusing on stroke.
Yeah, so stroke is so important. This is the month, American Stroke Month is May, and so we talk about the importance of recognizing stroke, and then Parkridge is part of HCA, and so as HCA we have a huge collaborative with the American Heart Association and a program called Getting to the Heart of Stroke. And it really talks about the importance of cardiac or heart as well as brain health and stroke, and those two are so tightly linked.
Because, I mean, in a layman's understanding of it, I've always thought of a heart attack is just a clot that goes to your heart and that a stroke is one that goes to your brain.
That is absolutely true.
Okay.
You said that perfectly. And the same way we think about time is muscle for the heart, time is important for the brain, because once you recognize symptoms of a stroke, it's really important that you act fast.
Okay, and FAST is operative because that's an acronym.
That's right. So FAST, facial drooping, arm weakness, speech difficulties. If you have any of those, it's time to call 911.
Okay.
And so that really is important because the treatment is really important on the time of symptoms.
And that has changed so much. I can think back, 25-ish years ago, somebody I knew who had a stroke, and it was very, very touch and go, but there was such optimism because finally here in town we had the abilities to really bring some innovative care. Now it's kind of accepted truth that you can really heal pretty easily from a stroke if you get there in time.
That's right. That's key, really, that time that you get there, because the longer there's a delay, the less likely you are to recover. But there's so many new treatments for stroke, so it's definitely different than it was 5 or 10 years ago.
Yeah.
And really just that very first statement, get to the emergency room, call 911, is really the most important part.
Okay, it's a little bit frightening to me though, because strokes are I guess all health issues can happen out of the blue. But there is no profile of a person really who's at risk of a stroke. You hear about it in very healthy people.
That is right. So there are different profiles. So the typical stroke patient will have high blood pressure. That's actually the number one preventable treatment for stroke, is reducing your blood pressure. But women are affected just as often as men, so we're not safe as women. And women actually have worse outcomes with stroke. So if you're a woman, you're more likely to die after a stroke.
Why?
It's probably related to a lot of things, including delay in getting to the hospital and different types of strokes that we have. The other important part to know is 1 in 4 people who have a stroke will have a second stroke. So once you have a stroke, it's really important that we try to figure out why you had that stroke.
Okay.
And that's really what this initiative, Getting to the Heart of Stroke, looks at. So some people have a stroke because they have blockages in their brain arteries, but some people have heart problems that cause a stroke, things like an irregular heart rhythm, like atrial fibrillation.
Right.
So it's really important that we go and look for those things, especially if you don't fit that classic profile,
Right.
like having high blood pressure.
So, okay, getting to the heart of stroke. Does that mean that anybody watching could reach out to Centennial Heart and say, look, heart disease runs in my family? Maybe it doesn't. Can they still call you?
Absolutely, and anybody that's watching can also log in. There's an entire website called Getting to the Heart of Stroke that's in partnership with the American Heart Association. It has learning modules for patients and healthcare members and lots of information. There's an app called the Stroke Helper app that allows people to get some health information as well as chart things like their blood pressure and their cholesterol and their diabetes numbers.
Right.
So lots of resources that are available.
So back to the time, because you mentioned that often women maybe don't get there in time. I'm guessing that's because maybe we tend to say, no, I'm fine.
Yes.
So do all strokes present obviously, or are they sometimes subtle?
They can be subtle. And so anytime you have neurologic findings that come on acutely or out of the blue and don't get better in a matter of minutes, I would say you need to be evaluated. Now again, the big ones are sort of that facial droop, arm weakness, difficulty speaking, but they can be much more subtle than that, and they can come and go before you actually have a larger symptom.
Okay, so on the arm weakness, I've always heard that a sign of a heart attack can be pain in your left arm. With a stroke, can it be either side?
It can be either side, and it could also be your legs. It could be, any weakness anywhere. It can be numbness and tingling. It doesn't have to be weakness. Sometimes it'll start out as numbness and tingling and then progress.
Okay, sometimes if you think you're experiencing something, then your mind can go places. So is it true that if you're having a stroke, whatever your symptoms are on that same side of the body?
It can be on either side. It kind
So
of
you can have both sides affected?
You could have both sides affected. It depends on where the stroke is, and is there one or is there more than one? Because sometimes people can have different areas of the brain affected at the same time.
When they come to you at Centennial Heart, if they have heart issues that run in their family, does that make them more likely to be at risk of stroke too?
Yes. So the risk factors for heart disease are very common and similar to the risk factors for stroke. The top ones are high blood pressure, high cholesterol, and a diet that's not healthy, inability to exercise or not exercising, smoking, sort of those classic ones that we think about being associated with heart disease.
Okay, I know that May is the awareness month. She and I were having a conversation before we went on camera about how we both are fans of things on our refrigerator. I like a printed out something. So you mentioned FAST. To give people a chance to write that down, remind us what that stands for.
Yes, so FAST is facial drooping, arm weakness, speech difficulty, and if any of those occur, it's time to call 911.
And I think you told me that there are different treatment options. Are those often medication?
There are medications and procedures, sort of depending on what type of stroke it is, where it's located in the brain, and what sort of time frame you've had since the symptoms started.
Okay, well you took a very kind of frightening, intimidating topic and you made it reassuring, so thank you for that.
You are welcome. Thank you for having me on. And again, the American Heart Association and Getting to the Heart of Stroke has lots of information for anyone who's interested.
And this is where you can find Dr. Bailey and all the different staff there at Parkridge Medical Center, parkridgehealth.com. You know where they are, right there on Macaulay Avenue, and it's Centennial Heart at Parkridge Health System. Thanks so much.
Thank you.
I'm Jonathan Lowe.